We had a lot of questions about which meds can you take in pregnancy.
Which meds are safe, or what should you do if you already are pregnant?
So we're going to do a video today talking about things that we consider as reproductive psychiatrists. My name is Nichelle Haynes.
I'm Dr. Kristen Lassiter.
And we're Medical Mamas. This is your place for evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
Okay, we get this question a lot, so I think this video is going to be really good for a lot of people because I think it just provides the framework for how we think about things when we're assessing meds versus not meds.
Yeah, and I think it also shows how complicated the thought process can be and how important it is to think through your individual situation and your history and what's worked for you in the past.
That's why we generally don't make blanket statements to say you can or cannot do this or you should or should not do that because it's very individualized.
So I would say an overall goal in pregnancy is to reduce the number of things that the baby is exposed to. So we say the goal is to reduce exposures, but what exactly are exposures?
Exposures would be like really anything that can affect the outcome or the health of the pregnancy, right? So illness is an exposure.
Medical illnesses, mental health illnesses.
Yeah, infection. I mean, just all of it, right? So illness of some kind, medications, environmental things like
alcohol, smoking.
Yeah. So we're talking about pregnancy, but I will say that when I was postpartum and still breastfeeding, there was a fire extinguisher that went off and I inhaled some of the fumes. And so I had to assess whether that was going to be an exposure that would limit the safety of breast milk at that time. So it's just like really anything.
And that even includes over-the-counter medications, supplements, herbs, really anything extra that you're putting into your body or that is going on in your body that's not necessarily just part of the natural process can be considered an exposure.
So speaking of illness as an exposure, I think there's a big myth, even in the medical community, that pregnancy is protective for mental illness, and that is absolutely not true.
Yeah, so what we see is that especially in people who have had a history of depression or anxiety in the past, pregnancy is actually a time that can exacerbate those symptoms. So it can make them worse if they're already there, or even if somebody's doing really well, it can bring back up those symptoms again.
And also it could just be a time where you see it for the first time
as well. There are a lot of people who it's their first episode ever of depression or anxiety or OCD or whatever.
Yeah. So maybe we split the categories into people who are planning ahead. What can we do to risk exposure or reduce risks and exposures? And then also people who are already pregnant or find out they're pregnant and happen to be on medication. Because of that, like a lot of pregnancies are unplanned.
Half. Yeah, I think it's half of pregnancies are unplanned. And so a lot of times we'll get people who say, I'm pregnant, should I stop my medication or should I continue my medication? And that's a really important question. And Dr. Haynes and I's big pet peeve is when a doctor will just say, yes, you have to stop this medication. You cannot take this medication in pregnancy. It's not safe.
I could just like, no, don't say that. And this is why we're making this video. We have a lot of things that we consider. We don't just like blanket statement say, do this or do that. So let's start with if you were already pregnant.
Okay.
Congratulations.
If you're already pregnant and you're on a psychiatric medication, even if you just took the pregnancy test and you're 4.5 weeks pregnant or 4 weeks pregnant or whatever, baby has already been exposed to the medication. Because also, like, let's say you decide that moment you're going to stop taking the medication, it's still in your system for at least another week, probably, depending on the medication, sometimes more than that. So baby's been exposed. So there's exposure number one.
Right. So if that medication is managing your illness and our goal is to reduce exposures, why are we going to either change to a new medication that adds another exposure in that could potentially add the exposure of illness as well?
Right, because let's say that you're like, oh, I'm pregnant, but I'm on some antidepressant that my doctor said I can't take, but they told me I need to switch to Zoloft instead. Well, Zoloft is then another medication that your baby's getting exposed to. And if you haven't used Zoloft in the past, or maybe you've used it, but it didn't work as good as the current medication you're on, well, then you're increasing your risk of the mental illness coming back because you haven't tried it before. We don't know if it's going to work, or if you used it in the past and it didn't work that well. And so now you're kind of creating an environment where symptoms might come back. So then baby gets exposed to the two different medications plus the mental illness.
Right. So that's why we generally don't recommend switching medications if there's not a clear reason why we would do so.
Yeah. And of course, everybody's situation is different. So definitely talk with your doctor about it and make sure it's a discussion, not just like you absolutely have to stop. Ask them why. Ask them what are the risks of the medication you're taking versus what are the risks of switching, making sure that you're really thinking it through.
Mm-hmm. Right. I will say there are very few where I'm like, yeah, we can't. We would much rather not have that risk.
Yeah.
And I would say that most of the antidepressants do not fall in that like extremely risky category where we would need to switch unless there was some other reason.
Right.
Yeah.
And the general rule, I will say, for perinatal psychiatrists in this community, our general rule of thumb is keep the patient on what has kept them well, or restart that if they get symptoms back in pregnancy and they're not on medication. Mm-hmm. General rule, of course, it can vary for different people.
Right, of course. Should we move on to if you have the opportunity to plan prior to conception? Okay, so it might even be that you want to start a year or more ahead of time,
which would be ideal.
Because say you're on a medication that is very risky, it might take a little bit of time to find something that's less risky to reduce risk of exposure or risk where one medicine is like very much more risky than another. It might take some time to find something that works that's less risky than the original that was working or something like that.
And you want to give the medication that you switch to enough time, like ideally 6 months to a year, to see, am I going to stay well on this medication?
I can't tell you how many reproductive age people I've had this discussion with, and they've never considered, oh, maybe I should choose something. If we're like brand new to medicine, right? Maybe I should choose something that is in that less risky category, hoping that in the future this won't be a thing that we have to address. It's like, okay, if in the future you are stable on this medication and you would like to get pregnant or accidentally get pregnant, it would be your least risky option to stay on this medicine.
Exactly. Yeah, so planning ahead is the ideal situation, and there's several medications that we have more research on in pregnancy than, say, the other medications. And so in the antidepressant category, if you're wanting to switch to something that has more research and we can more confidently talk about the risks of that medication in pregnancy, the general ones are sertraline, escitalopram, citalopram, fluoxetine, duloxetine, venlafaxine.
Yeah.
Those are the main ones.
With reassuring data. We have a lot of data about maybe some other ones that have less reassuring data.
Yeah, or we just don't have as much research on those.
Sure. And in that same kind of reassuring data category, if we're looking for a mood stabilizer, say for bipolar disorder, we have reassuring data about lamotrigine and lithium would be sort of our go-tos in that category.
Yeah. And in the same vein of trying to plan ahead for pregnancy, you also want to try and reduce the number of medications that you're on while staying stable. So if you need a medication to keep you well, then obviously you can't really stop taking it. Mm-hmm. If you need like a cocktail of medications of different ones. Yeah. But If, let's say, you can get rid of one and increase the dose of the other, and so then you can just be on 1 or 2 rather than like 4 or 5, that's also one of the goals. Because again, reducing exposure.
That's the whole thing.
Yeah.
So it's really complicated. What's worked for you in the past? What's working for you now? What are your goals? What else are you doing to support your mental health? What's the data show? I also, even in first consultations with people who are not intending to get pregnant, I will talk to them about, is it a possibility that someday you'll want to expand your family? If you do so, is breastfeeding something that you're interested in? I mean, we even talk about all of the things associated with that so that we look and kind of find the best choice for reducing exposure and risk at all stages that are possible for this person.
Yeah. And let's say you've tried those medications we listed that have more research and they didn't work for you. It's okay to take a medication that we don't have as much research on if that's the best choice for you, if that's what's going to keep you most healthy.
Mm-hmm. Right, because if we're, like we said before, if we're switching to something that doesn't work, then we had the first medication, the second medication, and the risk of illness, which we would just like to reduce exposures. The whole goal, reduce exposures.
Yeah.
Yeah.
Of course, talk with your own doctor. Make sure that what you're deciding on is best for you in particular. But we hope this video is helpful in terms of deciding which medications are safe to take in pregnancy and what you should do in your individual situation.
Right. Wonderful. Yeah, I really do hope that's helpful for a lot of people. It's a really common question. Yeah. Thank you so much for being here. Please like, comment, subscribe. We'll see you soon.
Bye.